Hey everyone, welcome back to our case series. My name is Dr. Iyer, I'm with Residency Medical, and we have another high-yield case for you to help you with your practice and your test taking. Let's get started with the case. We're going to start with a 46-year-old male who's coming in for a new lesion on his right arm. The skin lesion is pinkish colored and slightly itchy. He also takes no medications, but he has tried some over-the-counter creams and lotions to try to help the condition, but they've all failed to make an impact. He is sexually active with multiple partners and doesn't use condoms, and he has no other pertinent history in his vitals or in his physical exam besides the lesion. What do you think the diagnosis is? We're going to give you 4 options to choose from, and there'll also be a picture of the condition shown as well. The 4 options are A. Herpes simplex, B. Kaposi sarcoma, C. Condyloma acuminata, or D. Molluscum contagiosum. Comment your diagnosis below or the letter below, and come back next time for the answer. Did you get the diagnosis right? The answer was letter D, Molluscum contagiosum. And let's talk about some details about Molluscum contagiosum. So first of all, it's a pox virus, similar to smallpox and cowpox and the current monkeypox. But the thing about it is it's also very benign. It doesn't cause major problems, and it's just usually 1 or 2 solitary lesions on the body. However, it can get pretty severe if you're immunocompromised. So an HIV patient, an organ transplant patient, they could have multiple of these blisters, multiple of these lesions all over the skin, and it can be pretty cosmetically unattractive. So people who have this condition, sometimes instead of just letting them regress spontaneously, which it usually takes 1 or 2 years for it to happen, they opt for liquid nitrogen therapy so that they can get rid of it immediately. Finally, the way this thing spreads is through direct skin-to-skin contact. So this can happen either sexually or non-sexually. Non-sexually meaning such as touching someone who has an active lesion and not knowing, or a wrestling team, and sexually if they're having sex and they're having a lot of skin-to-skin contact. I hope you learned a lot from this case, and I'll see you next time for another.